Hello, today I want to talk about a very important topic. I want to talk about something that definitely affects everyone. Okay? Whether you're a woman, whether you're a male, this is something that really affects everyone. And I have gotten a lot of questions on this. And this is a topic that, like I said, everyone can definitely, absolutely relate to. People ask me questions. Why should I breastfeed? People come to me and they give me questions. I'm trying to get pregnant. Should I breastfeed my baby? And before I get into that, I want to say something. And I want you to watch this video to the very end. You probably have been wondering why I haven't been dumping and churning out content as I should. The truth of the matter, there are also other life situations and priorities that need our attention. But don't worry, I'm here now. Let's get right into it. So what I want to achieve in this video, in this particular video, I want to shed some light on this important topic. What do I believe in? I believe in the fact that if you know better, you do better. I believe in the fact that the quality of your decision is dependent on the information within your disposal. So, in this video, I will outline to you guys the reasons, the benefits of breastfeeding for both the mother as well as the child. And let me put this out there. Let me make it abundantly clear. This is not me telling you what to do. That is not my goal. It is up to you. The decision making is absolutely yours. My job is to guide you to make that decision. My job is to furnish you with the right information and you make the decision. So number one, why is it important for a mother to breastfeed? Again, I get all of it. I know we are in the generation where people want to preserve their anatomy. People do not want to breastfeed. They go for supplements. Some people give different reasons. Again, I am not here to tell you what to do. I am here to provide you the information and you can make the decision that is best for you. So number one of the important reasons for which a mother should breastfeed, not even for the child, this is what benefits the mother. One, a woman who breastfeeds is able to recover from childbirth. Breastfeeding allows a woman, a new mother, to recover quickly from the stress of childbirth. If you have ever had a child, if you have ever been associated with someone who had a child, who were given birth by someone, that experience is not easy. Women, my hands are in the air. I respect you guys. I couldn't do it. To house a baby for 9 months and go through all the hormonal changes, that is absolutely incredible. And if you have any woman in your life, you need to pause and give them the due credit and the flowers that they deserve. So number one reason why you should breastfeed your baby, it's not even for the baby now. This is to help you as a mother to recover from childbirth, because so many things happen during pregnancy. So many changes. That is another video in its entirety. So that's number one reason. Okay, when you breastfeed, it allows you to recover and get back to how you were prior to pregnancy. Number two, did you know that breastfeeding allows a mother to deal with the stress of postpartum issues that happen? Postpartum is after pregnancy, for those who do not know. So breastfeeding a child reduces the stress, the maternal response to stress. You see, sometimes when we talk about breastfeeding, it's always looked at from the perspective of the baby. We always look at how does this benefit the child. But now this is about the benefit to the mother. So it allows you, it allows the mother to deal with, to quickly recover from the changes of childbirth. That's number one. We talked about that. Number two, it reduces the stress, the maternal response to stress. Okay? And number three, breastfeeding. Did you know that breastfeeding is protective against postpartum depression? Like I mentioned before, pregnancy is not an easy job. It's a very challenging process or experience. There are so many changes that happen in the process of pregnancy, labor, delivery, and so on and so forth. Okay? So, breastfeeding allows the woman to recover from depression, postpartum depression. Did you know that there is something called postpartum blue? There's postpartum depression. And this is where, as a man, you have to be patient with your wife who just had a baby. Of course, we know they get cranky during pregnancy, and there's a belief, because we don't know, right? We tend to believe, now you've given birth to this child, get back to normalcy. It actually takes time. Some women experience depression after having a baby. So we call that postpartum depression. And this can last up to 12 months. Everyone is different. So breastfeeding, once again, puts a mother in a position to deal with the postpartum depression. All right? Did you know that breastfeeding allows a mother to lose weight? Breastfeeding allows a mother to lose weight after pregnancy. And let me explain that to you. During pregnancy, there's an increase in plasma volume. You got to understand, this woman is dealing with her own issues, and she's housing another baby. Okay? And that's why there's an increase in 300 calories a day in a pregnant woman. Because she's not just feeding herself, she's also feeding the fetus, the unborn child. So all those things put her in a position where she is just gaining weight. There's an increase in fluid retention. There's an increase in plasma volume. So one of the ways she can shed those weight that she had to put on during pregnancy is by breastfeeding. Okay? Did you know that breastfeeding reduces the risk of breast cancer? Are you aware of that? Did you know that? Well, now you know. If you know, you know. Now you know, right? That's it. Breastfeeding. In fact, when you read some of the risk factors for breast cancer, one of them is not breastfeeding. So a woman who does not breastfeed has a higher risk for breast cancer than a woman who breastfeeds her baby. I bet you did not know that, but now you know. Another one. Breastfeeding also reduces the risk of endometrial cancer. Did you know that? Are you aware of that? Now you know. Breastfeeding reduces the risk of endometrial cancer. Endometrium is your part of your uterus. So when a woman breastfeeds, she is drastically reducing. I think there's about 11% reduction in her risk of endometrial cancer. I gotta look into that. Okay? But yes, it has been established that when you breastfeed, you reduce your risk of breast cancer as well as endometrial cancer. Another one. Did you know that breastfeeding reduces your risk of hypertension? Maternal hypertension. So during pregnancy, there are different categories of hypertension a woman can have. She could either have chronic hypertension, which she already had before she became pregnant. We call that chronic hypertension. She could have gestational hypertension, which she developed during the course of the pregnancy. It usually happens, we usually see that after 20 weeks of gestation. Okay? Then she could have what we call preeclampsia. Preeclampsia is when you have hypertension during pregnancy, and then you have proteinuria, which is protein in your urine. You could have end organ damage, such as such as headache, which doesn't resolve when you take medication. You could have what we call thrombocytopenia, which is when your platelets drop. Platelets are the things in your body that make sure that you don't continue to bleed, right? There could be liver disease and kidney disease and so on and so forth. So, but the bottom line, without getting into the sophisticated part of the science behind this, the bottom line is a woman is being exposed to all kinds of hypertensive problems during pregnancy. Okay? So, being able to breastfeed after having a baby allows her, okay, it decreases the risk of maternal hypertension, and as well as cardiovascular disease. Okay, cardiovascular disease, heart disease, diseases that are related to the heart. Okay, so you can already see that there are so many benefits why a woman should breastfeed. Another one is that breastfeeding also reduces the risk of developing type 2 diabetes. Okay? Again, there's there's when women are pregnant, they have a likelihood of developing what we call gestational diabetes. Okay? That's diabetes that comes with pregnancy. And research has shown that women who have gestational diabetes, meaning women who develop diabetes when they were pregnant, they have an increased chance of developing type 2 diabetes after birth, after pregnancy. So again, breastfeeding helps in reducing the risk that they will transition from gestational diabetes to type 2 diabetes. You see that? Did you know that? Now you know. So these are some of the benefits and more for the mother. Now let's go to the benefit for the kid, for the child, right? The newborn baby. Why should you benefit? Why should you breastfeed? For the sake of the little baby. Okay? Breast milk is very powerful, very important. So breastfeeding. Let me tell you some of the things that are in breast milk. Because some of us, we really do not appreciate this. Okay? There's fat, there are carbohydrates, there are proteins, there are vitamins, there are minerals, of course there's water, there are immunoglobulins that help strengthen your immune system, there are white blood cells. Okay? So you see how many things that are embedded in the breast milk of a mother. So when a mother is not breastfeeding a baby, of course there are supplements. I get all of that. And if that's what you choose to do, no problem. But it's important that I provide you the right information. Okay, so breastfeeding a child not only positively benefits the mother, it also benefits the baby. Did you know that when you breastfeed the baby, you reduce the risk of infection that the baby would have contracted? You reduce the risk of infection in that child. So when you have a baby and they're always sick and sick and sick, and you did not breastfeed that baby, you were just giving them supplements and bottle feeding the baby, chances are that those problems may have been avoided had you breastfed the baby. Even breastfeeding can prevent the death of a child. You see that? So if you have not liked and subscribed to this channel, I really urge you to do so. I really urge you to do so. Because in this channel, we provide you an opportunity to have access to quality information that will put you in a better position to make good decisions about your health. And of course, once in a while, we discuss social problems, right? Because life is not just about health. So yeah, and again, in the comment section, if there's any health problem that you do not understand, or somebody has, or a friend of yours is dealing with, or that runs even in your family, and you want to understand the nuances and intricacies of those situations, leave me a comment. I will talk about it. Because if we learn, if we have a grasp of a situation, then we know how to deal with the situation, right? That's it. Thank you. Stay blessed.